It's a medical emergency. The doctors are in desperate need of their salaries. According to the doctors, give us our money by March 1st, 2021, or we will not look at the pandemic-related patients. This is what is coming from the doctors in Onoto Bay. Doctors at the Onoto Bay Hospital in St. Mary are quite upset over the non-payment of pandemic incentives, which they say have been owed to them for almost 12 months. One of the doctors, who said that he wants to remain anonymous, has mentioned that each time a claim is made, it is returned, and there is a request for additional information. He says at first they wanted a timetable, then a roster, and that was sent. Then a register was requested. Everyone signed the book. The reason keeps changing, and it seems no one is trying to help the doctors. Each time something else is being requested, and when they fulfill those requests, nothing happens. Some persons have not been paid from March. Some have not gotten their monies for July or August, while others are in receipt of salaries for July and August. To make matters worse, now they are hearing that only the last 3 months, October, November, and December 2020, will be paid. They have also heard that anything above that time period will not be paid. These are claims that were submitted long ago on behalf of the medical staff. The doctors have said that the issue is mainly affecting residents, and to the best of their knowledge, other staff members have been paid. The doctors have mentioned that some colleagues are in receipt of the incentive, but only for some months over the 1-year period. This is taking advantage of the doctors and other medical personnel, and it is wrong. It's been months that they have been putting themselves at risk. They have been going into the wards and taking care of patients, where, of course, they can easily contract these illnesses or also take home these illnesses to their families. Of course, now they are being given the runaround in an effort to prevent them from getting their monies. They are being told that they will get the last 3 months, but from March up to May 2020, it seems like the claim is that they will not be getting any salary for that. They are quite upset and see this as foolishness. According to the medical professionals, no one can expect them to continue working. There just seems to be a pushback every time that persons are to be paid. It was further stated that if they stop working, persons will pass away. Those being difficult cannot go on the ward and resuscitate a patient or attend to a patient. But they think that they can tell you how to examine a patient without even paying you. It's the attitude, and the attitude is wrong, as if to say, what are we going to do about it? They have spoken to their human resources and accounts departments many times with regards to these payments, but there is still no change, no improvement, or any good information. The doctors have also said that residents were recently informed by a regional representative that based on information received from the Human Resource Unit at the Northeast Regional Health Authority, the payment of special incentives for work in the pandemic environment has been stopped effective January 31st, 2021, until further advice is received from the Ministry of Finance. The doctor has said that as of March 1, if the payments that are owed to them are not received, all doctors that are affected have vowed not to continue working with these pandemic patients. March 21st will be 1 year since they have been working with this pandemic-related matter. Of course, they are quite upset, and they have to be working on these pandemic isolation wards, which is separate from their other ward work. They have said that normally they have the patients that are at their worst to care for, and the wards are mostly always filled with patients that are extremely ill. And again, this is separate from regular work. there's no guarantee that any of us will continue to be taken for granted in regards to our payments. Another doctor has mentioned that there have been suggestions that individuals who do not work on the pandemic wards are submitting claims, but has said that this is garbage because it seems that there's an implication of dishonesty. He further went on to explain that there is a ward where interaction takes place before confirmation of test results are had. On the regular wards, you will have very ill patients who are suspected. A test is done and those results do not return until 5 days' time. But you continue caring for them. Is that not interaction? A young patient who is very ill on the ward, which is not the pandemic ward, as she did not come in with any symptoms, is now positive from results that have been received. All of us, along with the nurses, have been attending to her as we always do, especially since she is extremely young and sick at the same time. So here we have a situation with positive patients who are not on the pandemic ward, but we are interacting and caring for them. Sometimes their results come back days later from the time of admission. So as you see, we are constantly exposed, and so are the accident and emergency medical team as well. Yet they have no desire to pay us because this interaction did not occur on the pandemic ward. However, as can be seen, we clearly interacted with the patient as the results would return later with a positive result. And this happens quite regularly. It's not even about the money, it's just for persons to see that there needs to be some level of regard for doctors and other medical professionals. They are constantly disrespecting us, and of course there is no appreciation. And now it's the government that is actually showing that there is little regard for the work that we do. If all the hospital doctors were to stop, everyone would pass away, as general practitioners cannot do hospital work, neither can the admin persons nor the regional persons. Hospital work is different. It is very, very important. If you are not in the hospitals, you cannot keep persons alive, as you just will not know how to. As doctors, they are tired, frustrated, and they feel underappreciated. Just to get the work done is a problem. It is quite exhausting, and we feel that it is unfair. We have no voice, and the hospital cannot operate without the doctors who have the necessary experience in hospital work. Like, comment, share, and subscribe. Let me know what you think about the medical doctors and the nurses' plight in this manner. They are at the Anata Bay Hospital, and they are in need of their pandemic-related incentives, as they have done the work. They have done excellent work in ensuring that the nation is kept alive for the last 12 months. And of course, it is only fair that they should receive proper remuneration for the services that they have provided to the nation of Jamaica.